When a patient comes to you with a central incisor missing, or even a lateral missing, okay, any of the aesthetic teeth, they might be asking you to only place one implant here. And you are the one who decides if all the anterior teeth are going to match each other, because once you fix one tooth and the neighboring teeth are very square or ugly or whatever, then they're going to say, why this tooth is looking like that? Why the neighboring tooth is looking shorter, longer? So you have an 11 millimeter tip here. If you see this catalog, from here till here, you have an 11 millimeter. So as soon as the patient sits on the dental chair, you hold this against the central. And if exactly this central is 11 millimeter, that means you have an average height of visible central incisor in this patient. They are not square or they are not too long. So then you have a starting golden proportion formula in your head. So if this is 11, all right, you might be able to do that with a ruler or caliper, but this is in front of you. If you put this on top and you have an 11 millimeter, it's very easy for you to visualize the crown. Mesiodistally is 7 millimeter. The shape is curved as the shape of the gingiva. And it is, you measure. If it's 11, fine. But what if it's not 11? Then you can tell the patient in the first visit, my dear, I have to raise the gingiva here to make the tooth look aesthetic. And if the neighboring tooth is looking too long or too short, then you can suggest gingivoplasty or any procedure, because you want ultimately your crown to look natural. So you can do that in, see how fast, in 1 second. That's it. Done. So this is very much useful in the first visit.